and 5 treatments on a walker for 2 months.
When they were talking surgery.
Exactly.
Hey everyone, I'm Dr. Garrett.
Dr. Danny.
And today we wanted to go over this very important and large chart that you can see next to us.
Why is everything so big?
Too big.
And this is something that we go over with all of our new patients.
Right.
Because a lot of people have never been to a chiropractor before and just don't know what we do as chiropractors or what we help treat the body with.
Right.
And I'm going to tell you everything you need to know.
Right. Or what we can. There's a lot of misconceptions out there of rolling neck and back pain doctors, but using chiropractic for only neck pain and back pain, we've heard this before.
Yes, I've heard this story before.
Yeah, it's like using your phone for just the calculators.
About 8 cubic inches of usable material. If I do a third, oh no, okay, hold on. I may only end up with about 3 pieces. Oh, the logic on that doesn't work. Now I'm not 100% sure that's the right. I'm not a mathematician.
So there's so much more to it, and that's why we wanted to go over this with you.
Yeah. So here on this side, you can see the different segments of the spine. So up here at the top, we have the cervical spine or the neck. Then the mid-back is the thoracic spine, and the lower back or the lumbar spine. And this chart is really important because it shows what parts of the nervous system go to what organs and tissues of the body.
Mind blown.
And it's important to know that your spine should be in a certain or proper alignment, and that allows all the information to start in your brain, travel down your spine and out the nerves to all these cells, tissues, and organs, and allows the body to heal and function at as close to 100% as possible.
Wow.
But what happens from the things we do on a daily basis, I mean, you and I know it's, we're pretty, abusive on our body. Right?
If you love me, let me go.
We beat ourselves up a lot, whether that's in here adjusting patients or just doing everyday activities, and that can cause misalignments in the spine.
Good to know.
Yep. And those misalignments are called subluxations. So that means one or more of the bones in the spine are out of alignment. They put pressure on the nerves, and then there's a disrupt in that communication to these different areas of the body.
Right, and we can even track this chart over one step further. So if we put pressure on the nerves because our spine is shifted out of alignment, we're subluxated, it goes to these tissues and organs, and then as a result, these are a list of possible symptoms of subluxations.
Your ideas are intriguing to me, and I wish to subscribe to your newsletter.
And some common things that we treat here in the office, and you probably have heard of these before, is headaches and migraines.
I heard that.
So we can see from the upper part of our spine, that C1 and C2 vertebra, which is really right at the base of our skull, that's where that would come from. So very simple to locate and adjust for that purpose. Other issues we see are things like stiff neck or neck pain, problems that travel down the arms, even things like carpal tunnel syndrome, comes from the lower segments of the spine, or cervical spine, I'm sorry. Because those nerves are pinched, those symptoms radiate out and down those nerves and can cause these issues here. And then if we move all the way down, probably the most common things people associate chiropractors with, sciatica and lower back pain.
Is it your back?
And that's going to come from the very bottom of the spine, L4 and L5. Those nerves actually combine and travel all the way down the leg and into the foot. So even though you might be having pain in the foot or the back of the leg, the problem is actually stemming from that pressure.
I'm feeling a lot of pressure.
Where the spine is shifted out of its normal position and is pinching the nerve here in the lower back.
How do we find those pinched nerves?
Yep. So we use palpation. So our hands We study and use them in school very, very vigorously. It takes a long time to develop the skills to feel them. We also use what's called a nerve scan. So we're measuring a temperature surrounding the nerves as they exit your spine, and that's called a surface EMG scan. It's pretty cool. The last thing we use, and probably the most importantly, is X-ray. So X-ray shows us exactly where the problem is, because palpation only gives us so much information.
Right.
Temperature increase leads us to an area, but that X-ray is going to show us exactly where the problem is and exactly what we need to do to fix it. So without those, we're really just guessing.
Right.
I despise guessing game.
And
right?
we don't like
And
to
we don't
guess,
do that,
especially when it comes to your spine
Yeah.
and your nervous system. We want to find out exactly where the problems are, so we know how to be as specific as possible with our adjustments and treatment.
Yeah.
So we can help people as much as we can.
Yep. All right, guys. Thanks so much.
Hey everybody, it's Dr. Baker. So I'm here with Marsha.
Marsha!
And Marsha has been a patient for 5 visits. And Marsha, when I first met you, you were on a walker.
Yes.
And how long were you on the walker for?
About 2 months.
2 months.
Oh boy, I gotta tell you, that sounds awful.
And her nerves in her back were so pinched going down her legs, she couldn't support her own weight. So she's been a patient now for 5 visits, going through corrective chiropractic care. And Marsha, tell everybody how you're feeling right now and how you're off this walker. This is amazing.
I'm not using the walker. You know, I have some times where it starts hurting again, but I come and I'm getting a lot better.
Yeah, and 5 treatments on a walker for 2 months.
When they were talking surgery.
Exactly. And the patient that referred you in was actually scheduled for surgery. We know who that patient is.
Yes.
We did the same thing with him.
Yes.
So Marsha had a condition where her nerves were so pinched going from her back to her legs. We adjusted her lower back at the L5 vertebrae, freeing up all those nerves to go to her legs, and now her legs are able to move and function better.
Yes.
So Marsha, you're just the very tip of the iceberg. You're going to get better and better every visit. But I want to thank you for sharing this inspirational story and testimonial for people, because there's somebody out there right now that's going to watch this and they're going to be like, wow, I need to go see the chiropractor.
Me, that's who.
Would you recommend Baker Chiropractic and Wellness to other people?
Yes, I couldn't sleep for 2 months with the pain going down my legs and around my hip. And the other night was the first night that I actually got complete sleep.
So you slept
Yeah,
through the whole
and I
night.
slept good last night too.
That's wonderful.
Something quite wonderful has happened.
Yes.
So Marsha, thank you so much for sharing your story. It's stories like these that'll change other people's lives.
Yes.
So thank you.
Yes.
And more importantly, Merry Christmas.
Merry Christmas.
Hey guys, we really hope you enjoyed this week's episode of Accelerated Health. Make sure you do the 4 things now. Comment, like, subscribe, and hit the notifications button. And we're wishing you all a very, very happy new year. We'll see you next week.